Well, here we
Oh,
are today on TAC Tic Talk with Dr. Carey Girgis, and I'm with the publisher of the American Chiropractor magazine, Jaclyn Touzard. I'm your editor, Dr. Joe Busch. And so, as we're going around the profession talking with different experts and chiropractors that are treating the most difficult conditions, we are always introduced by some of the special individuals across the country. And Dr. Girgis, excuse me, your name came up recently. You've been using an innovative technique to treat neuropathy. Can you talk a little bit about that?
Yes, as a matter of fact, we encountered Mike Barber, who is the founder and owner of the Microlight 830, the cold laser. And I was not so sure about cold lasers because I've tried them in the past and it did not show much results. However, when I was tested the Microlight 830, it was incredible results and I'm sold on it big time.
wow. Let me see here. It says with all of these, so you have an experience with other lasers prior to this. And so this is part of the reason we want to do this interview, right? Because a lot of the things that we're doing is always finding the latest and greatest in technologies and techniques. So on this one, this was kind of a game changer. Is that right?
It is. It was changed my practice entirely. I mean, when I tested it on my wife first because she had knee surgery and she had pain for a year and a half after the surgery. And when I used the Microlight on her for 2 weeks, that was sold me. And as a result, I have seven sets of Microlight 8 lasers in my office.
Well, when you get the
Wow.
ones that you love the most, better. I mean, it's kind of an
Absolutely,
automatic,
absolutely.
and she's on board. I'm sure she plays
Yeah,
a role in your admin there.
that's
So,
right.
why did you choose microlight laser? How did you come across them?
Microlight is really the advantage of microlight. First of all, is the safety issue. With the class 4 lasers, you have the danger of causing burns and hurting the patients. So really, the cold laser is just like that, cold. It does not produce heat and is very safe. And you can set it and leave it and not worry about having to hurt the patients at all. And as a matter of fact, it has the time factor. It's time savings because when you set it and you can walk away, it's hands free. The staff frees the staff time and has been beneficial. That our staff love it because they can set it up and walk away.
That's
And
outstanding. And there's yeah. Mhm.
also the cost factor. It's very cost efficient and effective because for the price of one hot laser I can buy 4 of those marker lights. It's incredible.
Mhm.
It's amazing and it's easy to use. You can staff easy to learn to manage it. As a matter of fact, some of the patients when they liked it so much, they bought their own.
Well, to be specific about the pricing, does that put it around, is it around the $10,000 mark,
It's
doctor?
under 10,000. It's about 7,000 really for a set of 2 plates. This is how if you can see those.
Hold it a little further back. Yeah, there
There
you
you
go.
go.
Okay,
There you
those are
go.
the
Yeah, this is
applicators.
this is the paddles, and this is the control, the battery, the controls. All you have to do is set it up, and once you set it up to the right setting, you walk away, and it's
Now,
an
do you know? No, that's incredible that they're hands free. So, what wavelength? Do you know what wavelength they use, or is that something that you
yeah.
paid
It uses
attention
the
to?
830 nanometers,
Ah,
and
well,
that
that's
is
the
the
reason for the
most
name,
widely
right?
researched
Mhm.
wavelength. It's actually used in research now for multiple conditions. They use it they're testing it for Alzheimer's and for dementia, for depression. The reason for that is it has the deepest penetrating light into the body. It goes about 2 inches deep. And as a result, it's
Okay,
able
so
to reach areas. Yes, it reaches areas that we normally couldn't reach before. Other than there are other cold lasers that are surface type, but this is very deep, and that's why I use it with the disc with disc herniations. It
whoa,
it
you
enables
use that.
the healing of the micro tears in the walls of the disc. This is
Mhm.
incredible.
So you're treating lumbar discs with this, or
Yes,
cervical
lumbar disc,
discs?
cervical disc,
Mhm.
disc herniation, disc bulging.
Okay, and then now is it continuous, or is it what kind of applications do they have?
It has up to 18 cycles at a time, and you set it up for
Hmm.
the 18 cycles, and you walk away, and
Hmm.
it stops automatically, so you don't have to worry about overdoing
Hmm.
anymore. That to start all over.
Right. So working on a lumbar disc, for example, I mean,
Yes,
how long are they going to have the applicator there?
it's usually about 10 minutes. The 18
Hmm.
cycles. Each cycle is a 30 seconds.
Hmm. All right, that's outstanding. So now, what have your patients said about this? I mean, your wife, you gave a great testimonial, but with regards to discs,
Well, the
I mean,
patients love it. The patients love it because, as a matter of fact, after if we give them a protocol for however many sessions that they need, and then sometimes they come back and say, "Can you do more laser because that's been helping me?" And so they love it because the results are evident. It's not something that you hope it will work. This it actually works. The pain goes away, the swelling goes away, the inflammation goes away, and the patient feels better. And that's what was outstanding, and the results are incredible. I even used it on shingles when patients came with had shingles, and we tried it on it, and it gets rid of shingles. The pain went away the first treatment. It was incredible.
Which I bet you're not allowed to say, right? We're never allowed to say it can help any of those things, but tell us more anecdotal.
No, that's a phenomenal endorsement. So now, can you direct us to some of the science? Do you have any access that we could, for that 830 nanometer wavelength?
Yeah, the wavelength has 90 milliwatts of power of penetration that allows it to penetrate deep into the body. And the cold laser activates the mitochondria of the cell to create the ATP molecule, which is the energy molecule for the cell. It's the engine of the cell to allow it to create healthy cells. So it allows healing faster, actually minimal scarring. When I treated with patients that have post-surgical knee surgery, and we treated the sutures, and by the time we're done, it was incredible. It takes about a couple of weeks of treatment, and the sutures come out amazing with no minimal scarring. Just you can see, it's incredible, and reduce the inflammation, reduce the pain.
Where are they out of? Do you know where the microlight laser company is?
They are in Houston, Texas.
Yeah. Okay.
Yes, Dr. Mike Barber is the owner and the founder of it. And actually, it has a double-blind study that was done in 2002 with General Motors, and they treated their employees who have carpal tunnel. And the FDA cleared that equipment in 2002, stating that this reduces inflammation and swelling for carpal tunnel syndrome. And obviously, it applies to other conditions besides that. And now the 830 nanometer wavelength is the most widely researched wavelength in the history so far. That's great.
Well, that's incredibly interesting. I hadn't heard a lot of studies that really focused on carpal tunnel up to this point. That's the first mention I've heard of that. Was that, in 2002, right? So was that the first?
That was done, and that's how it was patented by the FDA to do exactly that. But obviously, the same application works on other conditions: knee, ankle, shoulder. I treat all those conditions.
It implies
and
other things.
Neuropathy has been a tremendous effect. You mentioned the neuropathy in the beginning. We treat neuropathy with great success. It doesn't matter where the source of the neuropathy is from, because neuropathy happens. The most widely known source of neuropathy is diabetes. However, it's not the only one. Obvious toxicity, especially with patients who are receiving chemotherapy or toxic injury or burns. But the one area that is really neglected and not mentioned a lot is nerve root compression, which causes neuropathy. If you compress on the nerve at the lumbar spine, guess what? It diminishes the communication, exoplasmic flow from the brain to the feet, and the feet begins to have neuropathy. And so that is one of the major uses. I use it with combination with neuropathy and the decompression.
Like a radiculopathy, right?
Yes.
Okay. Very interesting. No, I'm incredibly excited to come across this technology. I, of course, use cold laser, but I definitely need to get myself a microlight laser to try, as I'm seeing these exact types of patients, and the hands-free option sounds incredible.
It is.
So
it saves time. My staff loved it because they can walk away and do other things, and it saves time. And the patients love it because they get the results, they feel the change in their body, and they're able to tell, and they request it. They have patients come back and say, "Could you use the laser on my TMJ? Can you use it on?" I even tried it on fractured ribs, and it reduces the pain and inflammation and heals the bone. It's incredible. Yes.
Well, and tell me, Dr. Girgis, because I remember the other day when we were speaking, what's the timeline from your first one to now, where I think, did you say you have 7? That seems amazing to me. how's your story evolved over how much
Actually,
time?
I have 7 and 1 personal that travels with me everywhere I go.
Really?
The reason I needed 7 because we're busy office, and I did not want to have patients to sit and wait. And so we have multiple areas that we can even treat at the same time. And we can treat the patient's knees and the feet or shoulder at the same time. So we required more. So the 7 comes in pair, really. So actually 14 paddles.
When did you first start and discover this? How long ago
We discovered that about 7 years ago, and I never looked back.
Oh, that's amazing. Because I remember you mentioning
7's the lucky number, Dr. Girgis.
It is, isn't it? Huh?
But from the time you got your first one to like the second, how did that go until you?
Well, the first one, after I was reluctant to take it, when Mike said to me, he said, "You know what, Dr. Girgis, just take it and try it for a month or 2, and if you don't like it, just send it back and don't pay me until then." I said, "You know what? I can't lose." But this guy has that confidence, and so that's when I tried it on my wife. And it produced results. When I bought it, I was able to pay for it within 3 weeks.
Wow.
In using it on the existing patients that I had that had conditions that I could not resolve. And with using the laser, it amazing results. And that's when it multiplied.
Wow. Then about how much do you discuss that? Is that different per patient, or is there a certain fee that is added on every time you use it? So is it going
whenever a patient presents with a condition that I can tell there's inflammation, which most of our patients have inflammation, whether it's in the spine or the joints or the musculoskeletal all over. So when they present that, immediately we just go to laser. We can do the adjustments, but as soon as you introduce the laser, then your outcome, the results speak for themselves.
Is it before or after the adjustment as well?
It doesn't matter. You can do it before or after, because once you start the process, even if the treatment itself for about 10 minutes, after there's the activated that mitochondria, you already activated the process of healing to take place. And that's not going to stop just because you stop the treatment. It continues on.
It's amazing.
Dr. Girgis, where did you go to school?
I went to Cleveland Chiropractic in Kansas City.
Okay, great. So you've been out there for a while. You've been
I've been around.
Tell me about that. How long have you been in practice?
I've been in practice almost 30 years now.
Holy smokes, 30 years. That's a lot of patients, right?
Yes.
So this has been one of the standout interventions that you
It
found.
changed my practice. It changed my practice. It's one of those things that I am actually, a lot of people ask me if I was going to retire, and I say, do what? Go fishing? I'm fine. We are the busiest ever been in our history, and we're doing the greatest time. We're having a lot of fun.
Well, good. I'm glad. Well, keep doing it. And quite an endorsement for microlight lasers, the 830. So if you're looking for another addition to your clinic, definitely this is an option to consider. And it sounds like if you get results similar to Dr. Girgis, well, you're not going fishing either. You're going to just keep on getting people better, right?
No, yeah.
Well, I wanted to ask one final question, because it seems to me like with microlight, this 830 nanometer, is it a patented? Does that mean it's exclusively only available through microlight? What is kind of, that's a question.
The 830 nanometer wavelength is patented to Microlight only, Microlight Corporation. They are the first ones to introduce cold laser, and in 2002, and they had to do a double-blind study to prove it and to get the clearance from the FDA. And after that, there's a lot of other cold laser later that come back, and they had a 510K, and they say we do the same thing, but they have not done the scrutiny or the studies that Microlight has. Microlight is actually been tested and cleared by the FDA. So that 830 nanometer is patented to Dr. Mike Barber, the corporation.
Microlight. Okay, I was going to say, because I would think that if you hear somebody saying cold laser, they're not all the same. Is that right then?
They're not all the same. The wavelength is the critical, and the power that sends it in, which has a 90 milliwatts of power to push it in, gives us the deepest penetrating cold light that goes into the body. And that's what makes it very efficient. It's unlike any other. And to use the hot lasers, that is a little bit more risky for me to use, and I love the safety of this. So
it's a lot more risky. It's a lot more risky.
Absolutely.
Yeah.
There's no need for it, and
No.
I get tremendous results. So why switch? So.
But that's what I was going to ask. So has this pretty much taken, do you use any other type of lasers other than this?
No,
now that you have
there's
it?
no need for it. I get all the results that I need and more than I expect. And we treat for just about every condition that happens with that inflammation or pain, and we're able to get better results. So why switch?
Were you using? Yeah, I was going to say, were you using any other lasers before discovering this one?
I used others, plenty of others, and none of them produced the results like this. I can't tell you the name. Sorry.
But in 30 years,
you tried to trap me, but I'm not able to.
I don't want you to do that, but I was going to say, because for people to understand, because we take a lot of heat.
But there's plenty on the market. There's plenty on the market.
Well, that's what I wanted to make sure of, is because we're always looking to tell people, that we're getting the latest and the greatest in front of them. And so for us to meet a doctor like you, who's had such great experience and a personal testimonial as well as professional, that's really saying a lot. And with your 30 year
And with Microlight, we get great service. I mean, if I have a one that for any reason the cord is torn or anything like that, I can send it and immediately I get back a return. Or sometimes they even send me a loaner to work with until I get the other one. They're great service.
Wow,
great.
That's amazing. That is a great testimonial too. Well, thank you so much. Dr. Joe has already signed off. He's obviously in between patients like you are too, Dr. Girgis. So we're walking the talk here between you and our editor as well, both in between seeing patients. So I appreciate you so much for taking the time out.
Well, thank you for working, making it work out.
Thank you so much. And definitely are working to get this in print as well so that our readers can take a look at your story in an upcoming issue of the American Chiropractor, as well as listening to this on our podcast. Thank you. Take care. Bye-bye.